Dye tests are done in the cardiac catheterization lab, also called the Cath lab. This test can be done if you are an inpatient or outpatient. About 20 to 30 dye tests are done every day. You will not be booked for a specific time. The schedule is made up for the day, and you will be told what number you are on the list. Your nurse can tell you approximately what time you will probably go to the lab. Please keep in mind that emergencies do happen, or tests take longer than planned, so last-minute changes have to be made to the schedule. Not all cardiologists do the dye test, so the cardiologist looking after you may not be the one performing the dye test. You will be asked to sign a consent form for the procedure. Before signing the consent, the doctor will discuss with you and your family the risks of having the dye test. There is a small risk of complications, which include damage to the vessel, bleeding, heart attack, stroke, emergency surgery, or even death.
Let's look at your preparation for an outpatient cardiac catheterization. If you're booked as an outpatient or day dye test, you'll have to come early because you'll be going home the same day. Once you're referred for cardiac catheterization, you'll be placed on a wait list. A cardiology booking officer will contact you by phone or by mail to let you know what day to come for your cardiac catheterization assessment.
You will be asked to come to the pre-assessment clinic on the day before your test. Please be sure to bring all of your medications, prescription, and herbals or vitamins in their bottles. When you come to the pre-assessment clinic, you will be seen by a nurse and a doctor, have blood drawn, and an ECG done. Be sure to tell the nurse or doctor of any allergies that you may have to medications, dye, or latex. They will arrange any further testing that is needed before your dye test, such as a stress test or an echocardiogram. They will also make any arrangements if you need to be seen by any other doctors before proceeding with your dye test. You will be shown this video, told what time to report to the hospital for the test, and instructed how to look after the test site. Take your medications in their bottles to the hospital with you. You will be told what medications you should take on the morning of your test. You will be told if you are allowed to eat or drink after midnight the night before your dye test. On the morning of your test, you report to the 6.1 day patient unit. You will be registered, shown to your room, any blood work will be drawn, and you will be given a light breakfast. You will return to the same room after the test. If you are an inpatient, then all required blood work and EKGs are to be done as part of your care. Most of the preparation to go for the dye test is the same for inpatients and outpatients. You may have an IV started. An IV is a small tube inserted into a vein in your hand or arm. It is used to give medications and/or fluids. Your groins will be shaved because the doctor will insert a tube or tubes into a vein in your groin to do the dye test. Outpatients may have their groins shaved in the pre-assessment clinic the day before the test. Both groins are shaved in case there is a problem inserting a tube on one side. The other side can be used. In some cases, the doctor may use an artery in your wrist or the bend of your elbow. If the doctor thinks he will use one of those sites, then those areas will be shaved. You will be awake during the dye test because the doctors and nurses in the lab will be asking you questions during the test about how you are feeling. You will be given a medication to help you relax during the test. You will be given the medication when there is a call from the Cath lab to say it is time for your test. At this time, you should use the bathroom, urinal, or commode. You wear only a hospital gown to the Cath lab. If you're walking or going in a wheelchair, you may wear a hospital dressing gown and your slippers. Your underwear, socks, and jewelry should be removed. Please do not take any valuables with you to the hospital. You may leave in your dentures, hearing aid, and wear your glasses. You may walk to the cath lab or go by wheelchair or stretcher. A nurse and/or hospital porter will accompany you. While your test is being done, your family can wait in the TV lounge.